Good morning. This is Dr. McDaniel at GYN Corner. I'm a board-certified obstetrician gynecologist in New York City, and I'm bringing to you all things health-related for women. Thank you for joining me today at GYN Corner. Today I thought I'd speak on a problem that comes up periodically in the office, and it seems like a small problem, but it's quite I guess I should say quite serious, and that is a thyroid nodule. So the thyroid is a gland on the inside the lower portion of your throat. It's right there. It looks like a butterfly. So you have two lobes. You have a lobe on the left side and a lobe on the right side. And periodically I'll have a patient, they're usually young, in their 20s or so. I'll have a patient who'll come in, and she comes in for routine annual. When I do the routine annual, that includes the breast exam, of course, but I also, because that's the way I was trained to feel above the clavicles for lymph nodes that are enlarged, and to feel for a thyroid enlargement or a nodule or a lump or a bump on the thyroid. And several times when I've done that, I've noticed a lump or a nodule or a bump on the thyroid, or that the thyroid is generally enlarged. And sometimes I'll ask the patient, because when I get their information, the history beforehand, I always ask if they have a primary care doctor. If they have the primary care doctor, when was their last exam with the primary care doctor, last full comprehensive physical exam? And oftentimes the last exam has been within a month or two. So I always ask, when I feel a nodule, so you know there's a little lump here. Did the PCP or your internist tell you there's a lump there? And they will 95+% of the time say, no, he or she didn't say there was a lump or didn't notice a lump. Then my next question will be, okay, did they feel your throat there during the exam? 50%, I'm going to even say 80%. 80% of the time they'll say no, they didn't feel the throat. When you see your primary care doctor for a comprehensive physical exam, that should be a full physical exam. It should be eyes, ears, nose, throat. They should do heart, lungs, do a breast exam. They should feel the abdomen. They should do reflexes and check for muscular strength, and they should check for that your nerves are intact. So they have you follow with the eyes, they have you tell if it's soft or sharp, that kind of thing. And they should also feel along the clavicles and along the thyroid. Majority of the time when I found a thyroid nodule, the patient has no clue, absolutely no clue, and she's seen a PCP and supposedly had a full physical within the last 3 months. So a thyroid nodule could be a little deal or it could be a big deal. First off, what's important is I tell everyone, when you do the breast exams, you should just look at your throat. I'm going to say about 25% of the time when I've noted a thyroid nodule, I could see it from just looking at the patient. I go, and I'm thinking to myself, it looks like her thyroid's enlarged. She probably knows, because it looks like I can see it's a little fuller here or a little fuller on the right side. And then when I feel it confirms, yes, is a lump there or it's fuller on that side. So sometimes I'll say, did you notice that it's a little bit of a